I'm Shauna Bradshaw, Dr. Mom HD, and welcome once again. Okay, so we've been talking about going back to school, and honestly, it is the most wonderful time of the year for parents. It may not always be the most wonderful time for a child. Going back to school may cause a lot of anxieties, and if it does cause a lot of anxieties, what do you do as a parent? You do the normal thing that you would normally do. You would talk to them, you would find out what the fear is around, or the anxiety is around, and maybe you've given them the homeopathic remedy Aconite that I've talked so much about this past month. But maybe Aconite isn't the actual remedy that they need. Maybe there's another remedy that they need. And this is where I would actually encourage you as parents to find a homeopath within your area that can deal with children's anxieties and getting them back into the classroom situation so that they aren't nervous about whatever it is. Sometimes the anxiety has nothing to do with the fear base of the unknown. It has more to do with the fact that they feel that they are incapable of being able to perform, or they're worried about being perfect, or they're worried about other things. There are better remedies out there that are much suitable for them at that point. Those types of anxieties are beyond what you would normally see as one that would be an acute situation or an urgent care situation is what we call it. So it's one of those things where you just take it a couple of times, and I'm talking about the Aconite remedy, and it just sort of subsides everything and everything seems to be fine. The remedies that these children might need might be a little bit more than that, and you might have to take it more often. So I'm thinking, getting a good diagnosis and getting a good consultation in about what's going on with that child will definitely help you and your child further along in the education system, especially if they're able to address it. And the remedy is safe and effective and natural. So what else can you do? Well, remember that there are other agencies out there that are available to you and able to help you as well. What I'm talking about is not your typical anxiety. Remember, this is something more unusual and not the normal type of anxiety where they're just worried for a little bit. They could be worried for a very long time, and it could actually stop them from actually having a good rest of the summer because they're almost crippled or paralyzed with the fear of going back to school, be it for whatever reason. This is where maybe you need to get some counseling involved, and maybe you need to get your child some help that way. Getting counseling is not something that you should be, saying, oh no, I'd be so embarrassed if I had to get counseling for my child. That has nothing to do with it. We all need help at one point, and asking for help actually is the biggest step that you're ever going to take. So by getting your child some help, if it's necessary, then that is something that you should be looking into. And of course, there are agencies all across our area that will help out with that as well. Other things that you can do in order to help your child out, obviously talk to your doctor about it too. I know that you're probably watching this video and thinking, why would you endorse a doctor's recommendation? Sometimes the doctor actually has some good insight because they have the good history on your child. So they might be able to say, it could be as simple as this, or I'm going to refer you to this psychiatrist, psychometrist, whatever the case may be, or psychologist, I should say. That's something that you would probably want. You want to have a good advocate in your corner. If you have a good relationship with your family doctor, why wouldn't you use that? As much as I don't always agree with the traditional drugs that they use for anxiety and depression and sadness and what have you, I have to say that sometimes it's necessary, and sometimes you have to do what is necessary. But also keep in mind that as a homeopath myself, there are great homeopathic remedies that can definitely help in this situation too. It's just a matter of make sure you're going down the proper channels. If you need a referral for a psychologist, then please use your doctor to refer on. Or find a homeopath that can help, but find one that actually knows what they're talking about and actually knows how to take a case for a child too, because children are different. Is it a child that's actually having this fear, or is it an adult like a teenager that you can actually talk to? These are just some tips that you need to look at, you need to figure out and make sure that all is well. So sometimes the children have the anxiety, it has to do with the transition from going from kindergarten to grade 1, grade 6 to grade 7, grade 8 to high school, and grade 9. Those can be problematic transition times. So talking to them about it and the expectations that are upon them may be something that you have to do as a parent, and get them through that. Try not to put too much pressure on your child because these transitions are really tough. That being said, I wish all your children a wonderful time back to school. I wish all you parents the most wonderful time as it is back to school season. And we get back into our regular routines of the year. Summertime is a wonderful time. Absolutely love it. It's my favorite time of year. But by the time the end of summer, as much as I'm sad to let it go, I'm happy that the routine's starting back up, and I hope you are too. So if you like these video e-zines, please follow me on Facebook, like me on Twitter, or like me on Facebook, follow me on Twitter. I always get those mixed up. And email me and let me know exactly what you're thinking. I'm Shauna Bradshaw, Dr. Mom HD, and you can find me at drmomhd.com. Once again, take care for now. I'll chat with you later. Bye.